Hello, and welcome to the Behavioral Health Matters podcast with Magellan Behavioral Health of Pennsylvania. This is the show that aims to promote positive mental health, increase our understanding of behavioral health topics and services, and reduce stigma. I'm your host, John Lees, and I'm the member and family advocate at Magellan of Pennsylvania here in the Lehigh Valley. On this episode, we'll be discussing a navigation guide for transitional age individuals with autism. This guide was created by the Magellan Autism Action Committee, and we'll learn more about the committee as well. We'll learn all about the ins and outs of developing this guide and how you can get your hands on a copy of the guide with our special guest, Matt Bowder, the Lehigh County Health Choices Administrator and a member of the committee. Stay tuned. At the end of this episode, we're going to be offering listeners of this episode a special surprise, so be sure to listen all the way through for those exciting details. And now, on to the show. So listen, Matt Bowder is here as our very first guest. Matt played a huge part in putting the navigation guide together that we'll be talking about on this episode. Matt is the Lehigh County Health Choices Administrator, and I've known Matt for a very long time. I've seen firsthand Matt's dedication and focus on making sure that the system is working for our members. Matt knows that behavioral health matters. And now here's my conversation with Matt Bowder. Welcome, Matt, to our very first episode of Behavioral Health Matters podcast. I want to especially thank you because it's our first episode ever. So thanks so much for joining us today.
Thanks, John. Appreciate the opportunity to be here and be first guest and talk about these important topics.
Thanks again. So before we kind of dive into our topic for today, Matt, if you would, just tell the listeners a little bit about yourself, maybe your background and a little bit about your role at the county.
Sure. I got interested in behavioral health when I was about 14 years old. I remember actually having a friend who talked to me about some struggles he was having, and I, at the time, wanted to be there for him, but really didn't know how to be. I didn't know the questions to ask or how to respond, and ever since that point, it just kind of became an area or a topic that I really wanted to learn more about. I didn't want to be back in that situation, so I got my bachelor's degree in clinical psychology from our science college down in Collegeville. And then I went on to get my master's in clinical psychology from Loyola College down in Baltimore. Moved back to the area where I grew up here and started working with kids and families as my first job. Really kind of enjoyed that work. Felt the connection kind of to those members that I had really hoped for in the work that I was looking to do. An opportunity presented itself after some time to get to work at the county. Also working in the child and adolescent field, so it was a nice transition for me. And the more I worked at the county, the more I was open to the field of mental health, behavioral health, and slowly wanted to branch out from the child and adolescent field. So I became a quality assurance manager within the Health Choices program. Really got to focus on the quality aspect of services that our members receive. Was slowly able to transition into the administrator role for Health Choices. And in Health Choices, we manage the Medicaid contract for the state for any Lehigh County member that has medical assistance. We don't manage the physical health side of things. We only manage the behavioral health and substance abuse side of services. But it's really forte of what I like to do and look to do. In my free time, I like to run, hike, be outside as much as possible. Love sun, love the summer. A little heartbreaking.
I'm with you on that.
A little heartbreaking to see summer coming to an end, but that's all right. It's all about transition and times a year, and but just like to be outside as much as possible, be active, enjoy life.
That's great. Well, again, thank you again for joining us for our very first episode and a really exciting topic that we're going to be discussing today. So let's talk a little bit about the Autism Action Committee, and that's the committee that actually was instrumental in putting this guide together. So what can you share with us from your perspective about the Autism Action Committee?
Sure. Well, first and foremost, within my program, or within the program, Health Choices program at Lehigh County, stakeholder feedback and really staying in touch with their stakeholders and members is of utmost importance for us. And the precursor to the Autism Action Committee was really an initiative we called Voice to Vision. And it was really, we called it a road show. We went to a number of different community organizations, locations, and settings, and really tried to get our members, families, young persons to come out and talk to us about what they're experiencing, what their needs were, what we could do better, what was going well for them, but what we could do better as well. And out of the Voice to Vision campaign, there were a number of things that were identified that we could follow up on. And one of them was really the need to develop a track or an option specifically for members and their families that were being affected by autism, and give them some greater options, give them some resources, and really try to look at what we could do better for them, both in terms of those resources and looking to see if there were other services that we might be able to develop. But really, hearing from them the struggles and the challenges that they faced, and knowing that we could do better for them, and wanting to do that.
That's awesome. And so it really has evolved, it sounds like, over the years. And in terms of the Autism Action Committee specifically, kind of really honing in on that population and what the committee could do to address gap areas and kind of build out services and resources.
Absolutely. It was really kind of eye-opening as we progressed from where we started in the committee to where we've gotten to now. It's great seeing the Transitional Age Navigation Guide, but there were a number of things that happened beforehand. We had actually done a navigation guide specifically for parents, families, and caregivers that their children or little ones were just getting diagnosed. So we knew that was kind of the first place to start. Where to direct them to make sure they're getting connected, and getting connected early. Mm-hmm. That was really one of the keys that we found out. But after we did that navigation guide, we focused on various services. We looked at evidence-based practices and tried to see what would fit best for our members and what was working best for them, and how we could build upon those successes. We also worked and identified some services within the adult community as well that we could try to develop, realizing it wasn't just our young members that needed the services. Adults needed the same kind of support. And then once we got done with that, we realized, well, wait, there's still more that we could be doing, and more members that we could be serving in a different way. And that discussion then led us to the Transition Age Navigation Guide, which, everything's a process. And, we started talking about this navigation guide for the transitional age, for transitional age members, probably about 2 to 3 years ago. Wow. Took some time, but we wanted to make sure we were comprehensive and focused on putting out the right product, not rushing it. And I'm really happy with the point that we've gotten to with it.
That's fantastic. And it really sounds like, input and engagement with the community, including families, was a big driver for the work of the committee.
It was crucial. Yeah. It was crucial. We could sit back as professionals all we want and say, well, we think we know, or, well, we've seen this, or we've dealt with this. But we're not in the same position as the families. We're not in the same position as our members. We need to hear from them to really understand, and really to be able to walk in their shoes and understand what they're experiencing, what their needs are, and how we can better meet those needs.
What a great approach. Okay, well, that's a perfect segue actually into the guide itself. So let's spend some time kind of getting an overview of the guide, but let's dive in a little bit further on the guide itself. Matt, can you talk a little bit about the population itself, transitional age youth? Can you kind of define that for the listener, and maybe talk about how that target group was selected for this guide?
Sure. The transitional age group, we realized once we started talking about them more in depth, was actually probably one of our largest, most complex groups out of all the groups within kind of the autism diagnosis that we talked about. And I don't think we necessarily realized that early on. When we started working with younger kids, that was pretty straightforward. It was how to get people connected. Once we started talking about adult services, it was, well, they're adults and there are certain things that they needed. But once we started thinking about transitional age, we realized how many different people and members got captured in that group. Because transitional age starts really, when you think about it, age 14.
Okay.
14 is you're coming out of your child and adolescence. You're getting to an age where you're gaining more independence, trying to learn who you're going to become as an adult, growing into an adult, moving into adulthood. How do you get ready for that?
And that's true for all kids.
Absolutely.
14 to, that those high school years. That's
Absolutely.
kind of what's the future holding for me. And now a brief message from Magellan. If you or a loved one are a Magellan of Pennsylvania member and have any questions about services, please visit www.magellanofpa.com for more information. And now, back to the show.
When you think about it, that age group encompasses so many different facets of life.
Absolutely. It's you're staring at your future right in front of you.
Absolutely. I mean, this is when you're becoming independent, when you're looking to become your own person, figure out who you are. And when you think about all the different things that you encounter during that time of your life, you're moving from education. Maybe you are moving on to a college or post-secondary type school or a trade school.
Right.
You're wanting to live on your own, maybe, or figuring out how you're going to live on your own or what that's going to look like. You're trying to take care of yourself for maybe the first time.
That kind of be independent on your own.
Absolutely. Yeah. Without necessarily all the help and assistance that you used to get. Not to say that that isn't still available to you.
Sure.
But trying to do it more on your own. And we realized that there was just so much that we could put together in terms of some information and some resources. And again, just being able to put information out there that helps our members understand and can figure out what they need at that point in time and try to figure out how to get it for themselves.
So would this guide be just for the transitional age individuals, or could others who maybe are a part of their lives also benefit from this guide?
We tried to create this guide so that it would be usable by everybody that touches it.
Oh, that's great.
And certainly we wanted to make it specific for the members, but we also realized maybe it was a caregiver, a parent that felt like their child was struggling in certain areas and wanted to see how they could assist with certain things. But we also wanted to make sure that it could benefit educators, therapists. Anybody that essentially the member comes in contact with, we want them to be a resource for the member just like we would. And we also want, obviously, the member to be an advocate for themselves. So that's why, we really tried to put it into language and terms and in a manner that anybody can look at it and hopefully understand it. Go to the section that corresponds to where they're at or what they need the most at that point in life, and be able to get the assistance that they need.
Oh, that's great. And so the guide, it sounds like there's a lot of different areas that are covered through the guide in terms of information and resources. Can you talk to the layout of the guide? Does someone have to read the entire guide? Can they go to a particular section if there's something they're looking for information about?
We tried to make it a comprehensive guide in the sense of start to finish what a transitional age member might have to think about or what their family might have to think about. But as comprehensive as the guide is, you can go to any section that is applicable to you or to that member or to that family or even to that educator at that time. each section stands on its own
Gotcha.
as much as it helps them kind of see the big picture as well. But we wanted it to be something that, again, people struggle with different aspects of their lives at different times. So
Right,
it wasn't,
right.
you have to read the first part to make it to the second part. It's, you can go to any part. Again, it's whatever you're struggling with or whatever challenges you're faced, you can go to that section and hopefully get some ideas about next steps and potential resources that you can turn to.
Oh, that's great. So it sounds very user friendly. The design of the guts. Can you talk a little about the layout, kind of the
Sure.
sections, any kind of key takeaways in terms of the usability of the guide?
Absolutely. Well, and this is, just like the Autism Action Committee in general started from our stakeholders and from hearing from our stakeholders, they were crucial in helping put together this guide. We couldn't have done it without them, nor would we want to.
Right.
We really listened to parents first and foremost around their experiences, what had happened for them, for their young person, what they've gone through, and we listened to them to really build what the guide is and what you see. This didn't come from professionals. This came from parents, caregivers, the people that are at the heart of the service. Unfortunately, I'll be honest, we struggled with getting actual members to participate. It's a very challenging age to get participation, but we were thrilled with the parents and caregivers and how they were able to help us grow this guide and obtain the finished product that you see.
That's great. And it's my understanding it is possible for folks to join the committee to continue this work, this type of work in the future. Is that true? It's
Absolutely.
Open kind of committee?
Absolutely.
Yeah.
This committee, we've always said there is no end date or end goal for this committee. We need to continue to hear from our stakeholders, just like we did from the very beginning. And the opportunity exists to participate at any point moving forward. We're not sure what the next steps are going to look like. We've done a lot. I think as we always do, now it's time to kind of take a step back, assess a little bit, see the impacts, and really try to understand the changes that we made, how they've impacted the system, hopefully for the better. And then we'll do what we normally do, and that's try to assess the system as it stands, and figure out what's next. I'll tell you, the COVID pandemic made lots of things change.
Yeah.
Our system is still trying to catch up to the changes that were brought about by the pandemic. So that might be something that the committee furthers as a next step or talks about. But there will always be next steps. That's something that we know about. In mental health and behavioral health, there is no stop. It's continuing to look. It's continuing to assess. Continuing to do better for our members, because behavioral health matters.
Yeah. So, and that's a perfect segue into the next step for this guide. So what do you see as or what has been the plan to distribute this and get this into the hands of those who will really benefit from it?
Sure. So first and foremost, we want it to be available to anybody. And that's one of the reasons why we are putting it on Magellan's website, on the county's websites. We live in such an electronic digital age that a lot of times online is the first place that people will go to get their information. So it's the first place that we wanted the information put. So Magellan PEA has it on their website. Lehigh County Health Choices webpage also has links to the both English and Spanish version of the guide. And we want to promote it to anybody that needs it and get it in the hands of anybody that can use it.
That's great.
As we mentioned, it could be for an educator, it could be for a therapist, could be for a grandparent, an aunt, uncle. It could be, for a friend of the family that just wants to help their friend with something more. Um, Access is key, though. So we do have the ability to get hard copies into people's hands if that's what they so choose. Some people prefer still having something
Right.
paper based
Old
to
school.
hold on to and to be able to look through at the leisure. But if you don't have a paper copy, you can always go online and get access to it there.
Okay, great. And now a brief word about how you can get a copy of the guide. You can get the digital version online at www.magellanofpa.com, along with the online resource guide that has key links and phone numbers. If you prefer a hard copy of the guide, they're available by emailing mbhofpa@magellanhealth.com. And now, back to the show. And so, Matt, did I also hear that there's an online resource guide available as well?
Yes, absolutely. One of the things that we wanted to make sure was that there was takeaways for the members as part of the guide. It's one thing to say, oh well, this is what you're going through, but it's another to actually then give some of the meat and potatoes around
The tools and
who
stuff,
you could go to make sure you're going to get these needs addressed in some way. So we didn't want to reinvent the wheel.
Right.
First off,
Makes sense.
we're not the ones. I mean, there are people that have already come up with these resources before us.
Right.
It wasn't for us to come up with the resources, but it's a matter of making sure people are aware of them and how to get to them.
Can actually concretely click a link, have a phone number, that kind of
Connect the
deal.
dots
Gotcha.
a little bit. Yeah. So we were very conscious about that when we were doing the guide in terms of the sections and then the resource guide. And what you'll see if you go and hopefully access the guide is that with each section, the sections correspond to sections in the resource guide. So that way, if you're dealing with school issues, you can go to the resource guide and find some of those specific school resources or who you would go to. If there are legal issues that you might be encountering, you can go to the legal section in the resource guide. We wanted to make sure people had something they could take away from it, not just having the guide. The guide's great, but if they're just going to have it as paper and not do anything with it, it doesn't accomplish the goal.
Right.
It doesn't get them to where they need to be to hopefully improve whatever they want to improve.
And we get their hands on that piece of information, that key contact that helps them advance and move forward.
That will make the difference
Gotcha.
to them at that time.
Right.
Yeah, I mean, services are great, but if you don't connect people to services, what good does it do?
Yeah, that's awesome. Such a great resource. And as we think about, this particular podcast, our goal really is to increase awareness, help to promote services and resources in our area, while we're also working to reduce stigma. And so this is a perfect example of a situation where we want to make sure people are aware of this guide, what it offers, and from my perspective, I think it fits, quite well into our mission here, which is to share that information. Can you talk a little bit about your perspective on where does this fit in terms of the overall system?
Sure.
As a tool?
Well, tool is exactly what it is. It's just another opportunity that we can provide to our members to really take their care and treatment into their own hands. And it's so important for our members to feel empowered to really address, whatever needs they might be encountering. If there's a struggle if they're dealing with, there's help and assistance out there for them. If they're struggling with anxiety, depression, or not sure where to turn, if they're about to graduate and want to continue on their education but have had struggles, those are all the things that we want our members to be able to think about and answer for themselves as best as possible. It's not to say that we aren't important advocates for our members
Sure.
as well. But first and foremost, it's making sure the member can do it as independently as possible. It feels that they can do it as independently as possible. Um, it's making sure they have the tools that they need to be successful and live good, productive, successful lives, whatever that means for them.
Matt, that's so great. And I really can't thank you enough for being with us to share all of this information about this fantastic resource in the navigation guide. So, Matt, thank you again for being with us.
Thank you, John. It was a pleasure. I was happy to be your first guest, and it's just always nice to be able to talk about such important topics like this and get the information out there.
Fantastic. And I couldn't have asked for a more perfect guest for the first episode of our new podcast.
Thank you.
So again, I appreciate it. Stick around. We'll be back to wrap things up, find out about the special surprise, and what we learned today. So what did we learn on this episode of the podcast? We learned that Magellan of Pennsylvania has a specific committee that supports individuals with autism right here in the Lehigh Valley. This committee is a collaborative group and is always looking for new members. If you are interested in finding out more information about the committee, please reach out to me at jglees@magellanhealth.com. We also learned about the newest resource created by the committee, the Navigation Guide for Transitional Age Individuals with Autism. We learned all about what went into creating the guide, what is contained within the guide, and we also learned that you can access the guide online or you can request a hard copy if you prefer. And now for our special surprise. We are offering listeners of this episode of the pod free Magellan of Pennsylvania swag, along with a hard copy of the guide, just for listening. We've got limited supplies available, so please email me at jglees@magellanhealth.com to get yours. We'd like to take this opportunity to thank our guest again, Matt Bowder, for joining us for our very first episode of the podcast, and for helping us get the word out about this exciting new resource. We'd like to thank all of you for listening to the podcast and invite you back for our next episode. If you have any questions or feedback about the pod, hit me up at jglees@magellanhealth.com. Well, that's it for this episode. I'm your host, John Lee, saying goodbye for now, and remember, behavioral health matters.